How can we manage cancer? Its hopes and highlights. Relevance to the topic, because you see, in India, from Kerala to northern part of India, many people are managing cancer, but the reported isolated success of cancer management is there. Moreover, absence of but scientifically documentation is not at all done there. Ayurvedic community is not well trained to face the challenge. That is another issue. Then this is a humble effort to frame a treatment strategy by using the available clinical experience and updated knowledge. Actually, you see, diseases are the external manifestations of the internal pathology. One definition is there for the disease. Tattal Lakshana Bodhida Abhyantara Vikriti Parambara Eva Paramarthato Roga. Actually, Lakshanas are no only the signs and symptoms are exhibited, but internal pathology is the foremost thing which we have to manage. See, cancer is a symbol, as most illnesses, of something going wrong in the patient's life, a warning to him. We have to take another route. That is another definition. You see, in the Samani Samprapti, Nidana Lishtu, Dosha Dushti, then Dhatu Dushti, at the time of Lakshanas will come. Then this Dhatu Dushti or Dosha Dushya Samorchana may lead to Dhatu Vikriti, which may be reversible or irreversible. Actually, this irreversible, when the irreversible Dhatu Dushti occurs, that will lead to chronic diseases like motor neuron disease, multiple sclerosis, Parkinsonism, malignancy, etc. Hence, here due to the Dosha Samorchana, irreparable damage to the Dhadus occur. That is why it is irreversible. Arbuda, you see, innumerable, immature, irreversible, purposeless. So cancer is a negative life energy. You see, there are 37 trillion cells in our body. Actually, you see, our skin cells are replenished every 15 days. Our RBCs are replenished every 120 days. Our liver cells are replenished every 6 months, which means that, within 1 second, 2 million RBCs are formed in our body, and around 2 million RBCs are destroyed also. Hence, it is very difficult to manage this programmed cell death. This is called programmed cell death. Hence, Vata is related with the cell division, Kapha is related with the cell nourishment and maturation. Hence, all the Arbuda has got generally a Vata Kapha background. A clinical study was conducted in Regional Cancer Center at Trivandrum, where we found out that almost 73% of people who are coming there with oral cancer comes under Vata Kapha Prakriti, which means that basic dosha profile of cancer is, we can consider this as Vata Kapha. It's a lifestyle problem. I am not because I am having only 15 minutes. Vidahyanam viruttanja tattacha asuk pradushanam bhajadam vidhihinanja. You see, actually all the nidanas of this Vata Rakta almost coincide with the nidanas of cancer also. That is also this is a coincidence actually. Old age, somatic mutation which is due to Vata. In old age, decline in immune competence is there due to which leads to Ojakshaya. Then virus and other microbes lead to Agantu, and family history is another reason. Age of a person and age of his individual organs will be different based on lifestyle. For example, a person who is drinking alcohol daily, his liver may be 60 years old, but he may be only 40 years old, which means that our age means it is a chronological age. Each and every organ in the body may differ in their own age. That is a age of the liver in a chronic alcoholic, and the age of the lung in a chain smoker will be more than the age of their chronological age. That is also very interesting thing. Idahi Atapanada, Recta Dufti, Mamsa Dufti. Arbuda has a Recta Mamsa background. In metastasis, then prognosis. This is very important. Regarding Vataka Paroga, almost all the Vataka Parogas are either Yapya or Asatya. For example, we can take Samakashwasa. So Yapya Samaka. The first and foremost Vataka disorder explained in our text is Tamakashwasa, which is Vatakapa. Vatakapa predominant. So Yasa Yapya Samaka. Satya Navova Belino Pavi, which means that the Agni Vaishamya caused by the Visheshan of Vata leads to defective formation of Sadhus. In almost all the Vata Virogas, Pitta will be inhibited, resulting in Agni Madhya. Then, as Agni Madhya takes a major role in the Samprapti of all the diseases, it is doubled in the case of Vata Virogas. There is no such rasa. Among Shatrasa, there is no such rasa which can be used commonly against Vata and Kapha. Then, Gurutvanja Mahatvanja Yasmal Nasti Vina Kapha. Definitely there will be some involvement of Kapha. Then, Adhisthana Peda, Nidana Svabhava, Sroto Rotha, everything then Agni also will be highly affected. Then, you see, due to Agni Madhya, Dhatu Agni Madhya occurs, on one side, it causes Dhatu Mara Sanchaya, which causes irritation of Dhadus and stimulation of carcinogen. The other side, Vyathichamatva Hinata exposes to carcinogen, and that leads to onset of the disease. The Samprapti can be summarized in this way. Then reduced appetite and decline in body weight seen long before the detection of disease, even in non-GIT, non-gastrointestinal tract cancers. In those cancers also, reduced appetite and decline in body weight can be seen, indicating long-lasting, chronic and deep-seated Agni Madhya. That is why in the Siddhanta of Kaya Chikitsa is Esha Saras Chikitsayam Yadagane Parirakshanam. The essence of all the Kaya Chikitsa principles is Esha Saras Chikitsayam Yadagane Parirakshanam. You see, abnormal cells are formed in the body frequently. Normally, they are silenced and destroyed by our immune system. This mechanism fails in cancer. Hence, indicates the role of altered immunity. Actually, this is a case of immunity loss disease. Then, cancer in Ayurveda hopes. Curative, supportive, preventive, psychological, community level. In many levels, we can actually interfere. In line of approach in some of the cancers, hepatocellular carcinoma with jaundice, treatment of Ruthapatha Kamila plus treatment of Ekrit Vidyarthi. This is very successfully done by many of the Kerala Vaidyas. Then rectal carcinoma, actually this is a treatment of terminal stage of abscess. In most of the cancer diseases, Rasayana Aushadas are most considered to be effective. For example, in rectal carcinoma, many Kerala Vaidyas use Halladaka Rasayana. Shushkeshu Halladaka Magrimuktam, Vaishajyam Ardreshu to Varsakatva. Halladaka is considered to be one of the Agri Aushada for abscess. Hence, according to Dr. L. Mahadevan, who is not here now, according to his opinion, all the terminal diseases can be considered as malignancy of that particular system. For example, if in abscess, chronic ulcers, in abscess, chronic ulcers or Sanivadiga abscess can be considered as rectal carcinoma. In that way also we can consider cancer. Then cancer versus Rasayana. Disease of age, regime of aging. Immunodeficiency will be there in cancer, but all the Rasayana Aushadas are immunomodulatory. Like Guluchi, Ashwagandha, any medicine you can take, immunomodulatory. Then Agni Madhya, definitely there will be all the Rasayana Aushadas are Agni Deepana. Then it produces Shoshana, all the Rasayana Aushadas are Brahmana. These are some of the Rasayana Aushadas which can be used against cancer. For example, in many of the cases, Vartamana Vipali And this Brahmarasayana is also considered to be very effective because, in the indication of Brahmarasayana, no diseases are told. For all the rasayanas, for example, Chavanaprasha, Kasam, Shwasam, Jaram, Shosham, Hridrogam, Vadachondagam, many diseases are explained. But in this Palasurdi of Brahmarasayana, no diseases are told, which means that, it is actually meant for improving our immunity, which can be used for many types of cancer, for improving the immunity. Then Pannadaga is also one of the best medicine. Then scope of Ayurveda in primary prevention in cases with a positive family history, healthy life, because they are actually at that time the positive family history is there, but at that time they are not cancer patients. Definitely we can manage the case with a healthy lifestyle and suitable application of Rasayana. Then in susceptible people, definitely they are very susceptible. Then some people are susceptible. In those cases, Shodhana Chikitsa plus suitable Rasayana. You see, I already told you that Vata Kapha predominance will be there in cancer patients' Prakriti, which means that, if we can, now the Prakriti Parisha is going on by NCIM. If we can isolate the Vata Kapha predominant people in the society, they can be screened for various type of cancer. Definitely, that will be a very effective remedy for detecting early cancer, because Vata Kapha predominant Prakriti people are very susceptible to be affected with cancer. You see, in secondary prevention, patients with complete treatment after breast cancer or after cerebral tumor, they completed treatment with chemotherapy and radiation. Then the doctors are monitoring every 6 months. At that time, definitely, this is the right time for using Ayurvedic medicine. I emphasize, Vyadhikshamaghara treatment can be done, and suitable Rasayana also can be applied. Then add-on therapy. For example, during the chemotherapy, radiation, many people are having many side effects like vomiting, fatigue, fever, many problems are occurring. During those application of those medicines also, definitely we can add on therapy with Ayurvedic medicines, by which, these complaints can be reduced and the tolerance of modern medicine can be increased. That is very, very important. Each medicine should be tolerant to the patient. Tolerance can be improved with Ayurvedic medicine. This is very frequently practiced in Kerala. Add-on therapy for better tolerance of radiation and chemotherapy, and community level awareness and health screening also. As I told earlier, Vata Kapha people can be screened and early detection can be done. In mucus gland, this is my own clinical experience, in mucus gland tumor, adenoid cystic carcinoma, after surgery and radiation, Ayurvedic drugs were prescribed and we were able to prolong the lifespan of the patient for 20 years. You see, actually there also we gave the medicine, Vyadhikara medicines. Actually in that case we gave, this Varanadi Kashaya along with Gurgurutta Krita was given for 6 months. And after that, every year the patient was advised to take medicines for 2 months. Because, the further recurrence, because this is a very vulnerable tumor, every chance of recurrence is there. Doctors want maximum 2 or 3 years only the patient will survive. But with Ayurvedic management, supportive therapy, we were able to extend the lifespan for 20 years. It is a great achievement. In this way, in many cases we can manage, because nowadays the modern medicine is capable of managing the case, but they don't know how to prevent the recurrence. At that time, this is the right time for Ayurvedic doctors to intervene. Rasayana Aushadas improve the nutritional status in cancer patients by increasing the immunity. Most of the Naimittika Rasayana, you see, Acharya Dalhana divides the Rasayana into 3. Kamyam, Naimittikam and Ajasrigam. And Naimittika Rasayana is exclusive for the treatment of diseases. Leshina, Pallataka, Tippali. Oh, you see, all the Naimittika Rasayanas are having Vata Kapha property. It's a very interesting coincidence, Although name Pallataka, Leshuna, Vartha, Tippani, all these Haritaki, all these Naimiti Rasayanas are having Vatakapa Hara property. Then a 40-year-old healthy male, routine blood investigations reveal leukocytosis. You see, at that time the patient is not at all a cancer patient, but he is very, very healthy. Detailed investigations confirmed chronic lymphatic leukemia. He was asymptomatic and will be so for the next 4 years also. Doctor said, do not interfere because you will be normal for 4 years. You can watch after every 6 months we have to see the blood checking. For an Ayurvedic physician, what should be the line of management? It is very, very difficult. Because, our science is a Lakshana Shastra. I already told that. Tatta Lakshana Bhoti Apyantara Vigirti Parambara Eva Paramartha Roga. If some Lakshanas are there, definitely we can interfere. He is a very healthy man. How can we interfere? It is very, very difficult. I placed this question before this scientific gathering because a patient is cancer patient, but he is not having any lakshanas. How can we manage? This is a very, very, very difficult situation. Sometimes you can say that we can do some panchakarma, some snehapana, some Sayana, we can use. But according to what is the direction of the treatment, in which way we have to direct the treatment, that is a problem. Every 30 seconds, a child dies of diarrhea in India. But according to a study by Dr. Valkurtis of the London School of Hygiene and Tropical Medicine, washing hands with soap and water before giving food to the child, alone reduces the risk of diarrhea death by 47%. Such a magical prevention is not possible in the case of cancer because it's a very chronic disease. But right diet, right exercise, right thinking can prevent the risk of developing cancer. In acute myocardial infarction, after emergency management and with the proper medication, patient live for many, many years. We all know that. But in cancer, after detection, the patient cannot live for a long period. What is the reason? Vishado rogavartananam sreshtam. That is the thing. Vishado rogavartananam sreshtam. Immediately after the detection of cancer, aggressive spreading is seen. The disease may be silent for years unknowingly. It highlights the psychological influence of immunity. Asha, in another version is there. Ashavan vyati mokshaya sadhyo vrinam apohati. You see, depression is a partial surrender to death, and it seems that cancer is a despair experienced at the cellular level. Despair experienced at the cellular level. Hence, we should change the attitude of the patient by making awareness and counseling, whereby the lifespan and quality of life can be improved. This is our ultimate aim. Let us make a combined effort to fight against this emperor of all melodies. Do you know Emperor of all melodies is a text written by Siddhartha Mukherjee. It explains the biography of cancer. If you have not read, definitely you have read. It's a very good text, by Siddhartha Mukherjee. The name of the text is book is Emperor of all melodies. It's a biography of cancer. Rays of hope are not far away. Thank you.